Currently, the positioning system in Lyon has 2 cameras installed at 90 degrees of each other. With this configuration, I am able to acquire reference images with the chair in desired positions. Then, when I reposition the patient on the chair, I can verify the patient's position based on the skin surface of the patient in a 3-dimensional plan. When I first set up a patient, at the end of the positioning definition, I primarily acquire reference images without region of interest, and then with a region of interest, focus on the treatment area. Then, when patient comes back to be set up again on the chair, I help the patient to find again his position on the chair. In a few cases, it's necessary to adjust his position, but it's rare. I use this system as I use a surface-guided radiotherapy system with the advantage for the patient to have no light, no flashlight in the treatment room. The main advantage of the optical or surface images is to be able to verify the external position of the patient without X-ray. Moreover, I use no landmarks or no tattoo on the skin, on the patient's skin. However, this system needs to see the patient's skin to work, so we cannot cover patients with a sheet or gauze. As a radiation therapist, I think we have to keep in mind the respect of our patient's intimacy. I think this system is a key feature in the positioning setup of the patient. In the future, with additional cameras, we will be able to acquire reference images and verify repositioning from different chair positions without rotating, and that is a good point. Our future clinical studies will give more information about the correlation between external position of the body and internal body position or soft tissue organs position. In the supine position, the literature shows that surface images are completely correlated with X-ray images for breast localization and also for bony anatomy in the pelvic. With patient in upright position, we might have some good surprise with some good correlation between external position and organs position, potentially resulting in us to rethinking the image-guided radiotherapy protocols currently used. Finally, if the upright position improves the patient engagement in the care, as we can suppose, we can imagine to educate patients in order to understand this image, and thus from a screen in front of them, they would be able to adjust their position with the overall objective to improve their repositioning and their comfort.